in their childhood and the stresses of everyday life, I think, is what brought upon me the pains which I have come to feel.
When I started to think about my sources of rage or anger, I started to go through the different phases, from infancy to self-imposed personality and to daily pressures in life. And I started to make the connection that although I'm a very driven person and I'm very responsible and I like to do the right thing, that these are all nice things that people will look at and say, oh, well, those are good qualities to have. But I realize that they are really a source of my rage, because there are things that you put on yourself that you really sort of can't measure up to in a way.
After thinking about it, I believe the biggest source of my unconscious rage is my family. It's surprising to think that the people that you love the most can also contribute to your unconscious rage. But that's probably true. I work in a family practice with my father and my older brother, and I'm expected to do things a certain way, and I have certain family obligations that I can never really get out of, and that probably causes a lot of unconscious rage.
Great periods of stress in my life, psychological stress, physical stress, has always manifested itself in some sort of pain syndrome, mostly having to do with trunk or limbs. I'm not a headache type person or a stomach ache type person necessarily, but mostly back aches, pains in arms, pains in legs, pains in neck.
After having listened to him talk, I could see myself on every view graph, in every bit of his description, and I actually realized that what I was not dealing with was actually still there and manifesting itself in different ways.
Well, here's what you've been waiting for. How do you get better? We said at the beginning, didn't we, that this presentation is the treatment. Now, what I hope to do now is to make clear to you why that is so, because when you come to think of it, that's a pretty preposterous kind of thing, isn't it? We associate medical treatment with medications, surgical procedures, injections, physical exercises, all sorts of things. And here we are treating you with words. However, as you well know, through the things that I've written, we've done this for many years with thousands of patients. And therefore, we've seen that it can be successful, and we've tried to understand why it's successful. It's clear now, isn't it, that the rage is responsible for the symptoms. Therefore, if this were to come out in some fashion, it's perfectly obvious, isn't it, that there would be no necessity for the pain. The problem is that it's not going to come out. Therefore, how can we possibly get better? Ah, yes.
So, Dr. Sarno, if the rage comes out, the pain goes away, how can I get my rage out?
Yeah, well, that's the point. You can't. Because the process of repression assisted by the physical symptomatology works. And it's only under extremely rare circumstances that the rage does come out, and I'm going to describe a case like that for you in a moment. But under normal circumstances, and this is why people continue to have these symptoms and continue to get depressed and anxious and so on, is that it's still there and it's going to stay there. Okay? What we have to do is try in some fashion to get these symptoms to stop, even though the rage remains there. That's the secret. Now, I said that I was going to tell you a story. It's a very sad story in one way, and yet in another, a hopeful story. This is about a person, a woman, who had been sexually abused as a child and had totally repressed. The experience had been so terrible, had totally repressed the memory of this for many, many years. Then it happened, and she must have been in her early 40s at this time, that she began to remember. And she decided that she would attend this meeting, this encounter group of other women in her community had been victims of incest as well. And she said it was a very emotional experience. And on the day that she went to this meeting, she began to have back pain. Now, she knew all about TMS. She'd been through the program. She said, well, I've got nothing to worry about. I mean, I know what this is. It'll probably go away because I know what it is, but it didn't go away. Over the next 48 hours, as the rage got closer to the surface, the pain increased. And she really didn't understand it. And then, of course, something happened. What I said almost never happens, happened in this case. She literally had an emotional explosion, and her description of this, of course, which is in one of my books, is very moving. She reacted and cried and screamed in rage. She wanted to cut her wrists and die and never come out from under the covers, and she carried on like this. She was having an emotional explosion. And as she did, that excruciating pain disappeared. Amazing. Now, before I knew about this case, I had already concluded that the purpose of the pain was to make sure that this didn't come out. But boy, this certainly demonstrated that that was true, that that's exactly the way this works, because as soon as this terrible stuff came out, her pain disappeared. All right, now you're going to say to me, well, make my rage come out, so my pain will disappear. But as I said, I can't. Yes?
Hey, Dr. Sarno, I fly into rages all the time. How come my pain doesn't go away?
Yeah, because the anger that you're generating up here, you're aware of, and that has nothing to do with this. The anger that is responsible for this is in the unconscious, and that's very, very different. Indeed, the anger that you're generating up here may be a reaction to this. It may be what the psychologists call a displacement. But the point is, any anger that you're aware of has nothing to do with TMS. All right, now we come to the crucial question. If my rage doesn't come out, how am I going to get better? Why do I get better? Now, bear in mind that people have been doing this and have been getting better for a long time, for many years. And also bear in mind that there are people who read one of the books and get better. Now, you ask yourself, how can that be? And the only explanation that I can come up with is that if the rage doesn't come out by teaching you about this, in a sense, we must be going in. We are breaching this. Well, we're breaching it intellectually. You're not feeling this rage, but you're being told about it, and you're being told how big it is. And you're learning about all the things that are responsible for it. Apparently, that's good enough. And indeed, when that is not good enough, it's a signal to us that we've got to do more exploring about those things that are responsible for the rage, and that's why 20 to 25% of the people that come into this program are going to be working with one of my psychologists. So this is almost a proof of the way the thing works. If the material under there, if the processes under there are strong enough that are producing the rage, then we're going to need to do some additional work to get at the root of what's behind this. Yeah?
Dr. Sarno, how am I going to get better if the rage doesn't come out?
By learning about the rage and the reasons for it. The rage doesn't come out, we're going in. Yes?
Dr. Sarno, I just find it hard to believe that just by learning about something, I can make physical pain go away.
I have no other way to explain what we have observed in thousands of people over the years. There is no other actually, there might be another explanation as to the exact mechanism of it, but this we know only from what we've seen, from what we've experienced with a large number of people over many years. All right, now, as part of this process, in other words, you got to do some things. I'm telling you about this now, but as you'll see in a moment from another visual we have here, you're not going to walk out of here free of pain. You have to think about all of these things for a while. And the first thing, I don't have a real physical problem in the usual sense of the word. That's why we said at the beginning, my back is normal. Secondly, I understand now about what's going on psychologically. I understand about the rage and the things that are behind it. And I understand that this is normal. This is normal for me, it's normal for virtually everybody in the Western world.
Dr. Sarno, let me see if I have it. Normally, if my back hurts, I want to put ice or heat on it or lay in a hot tub. What I think I hear you saying is that that's not going to help me, and in fact it may actually delay my recovery. Is that right?
It could help you momentarily to get a little relief from your pain. But in the long run, that's exactly what it'll do. It'll stop you from really getting better because you'll be focused on the physical, and as we've said, this is not a physical problem. This is a psychological situation with physical manifestations. All right, now, how do we go about it? What we mean here when we say think psychological, this is not easy to do, I acknowledge. But as you're going through this in the weeks to come, and you're going to be working on this on a daily basis, whenever you find yourself registering thoughts about the pain, try to force yourself to get away from that and to think about the things that we're talking about now, about the psychology behind this. This may sound silly, but talking to your brain is a good idea. Patients have told me that they do this, and it seems to be helpful. Think about it, it's sort of your conscious you talking to your unconscious you. A lot of people find that it's very helpful to make a list of all the pressures in their lives. And again, you're going to review this on a daily basis. Be sure you put at the top of the list your own personality characteristics, because they will inevitably be the most important of the pressures. You're all getting a study guide. You should work with it every day. And remember that this is something that you have to do. Nobody can do it for you. That's what's very different about this. As we said before, conventional medical treatment, the doctor will do something to you, for you, give you something, and so on, and then you take it. You're a passive recipient. Here, you are active in this process. You are the most important part of this process. You are essentially going to cure yourself. We're simply telling you how to go about it. And then this is very important, and that is, at the appropriate time, you'll resume normal physical activity. When is that appropriate time? What I generally suggest to people is they wait until the pain is pretty much gone, and then gradually introduce their physical activities again and try to get back to where you were before you ever had any problems of this kind. Remember, you cannot hurt yourself. Let's say you start doing it a little bit too soon. Well, the evidence that you started a little too soon is that you'll get some pain. Well, fine, you know that you're programmed, you're still programmed, and so what you do is back off, wait a little while, and then go back to it again.
Dr. Sarno,
Yeah.
what will this study guide tell me to do, and how can I work on this on a daily basis?
Well, you set aside the time each day, and the study guide is going to suggest certain things for you to do. So you read a certain number of pages of a book each day. Remember to think about the rage. Remember to look at your written list and so on. It'll sort of help you, keep you organized in your studying and thinking in the weeks to come.
Dr.
Yes.
Sarno, I've read your book, Healing Back Pain, and it was very helpful to me. As a matter of fact, it virtually eliminated my pain. So do you recommend that we reread any of your books? And if so, what particular sections do you think would be most helpful?
Well, again, follow the guide, the program and the guide, because that will make suggestion. What I usually suggest is that the first time or two around, you read the whole thing. After that, I recommend just reading the psychology chapter and the treatment chapter and keep going over those. You know, repetition appears to be very, very important for this. I've found this out over the years. And that's why it's important to keep working on this on a day-to-day basis. Keep thinking about these things. And it will help to drive the concepts in. It will help to reprogram your unconscious mind. Yes.
How can I think psychologically when I hurt so badly?
It isn't easy, I know. And actually, I will prescribe pain-killing medications for people as they're going through this program if the pain is very severe. So you should certainly take advantage of that and use something like that. I do not prescribe the anti-inflammatory drugs or tranquilizers or things of that sort. I think the important thing here is to have your pain reduced so you can concentrate on your thinking and on your studying. So, as we said, make sure that you find time each day. It is very, very important. I've had people call me up and say, I'm not better. Well, have you been working on the program? Well, I've been too busy. Well, you can't expect to get better if you don't do your homework. Review your pressure list every day. Don't give up. It takes time, and that's another thing. Of course, naturally, some people are anxious to have it be over with. Well, it may take time. And as we said before, start your physical program when the pain is almost gone. Yes?
I'm very excited about the idea of getting back to exercising, but I'm also a little afraid. How would you recommend that I go about getting back into it?
Okay. Start very slowly and gradually. As a matter of fact, I'm glad you brought this up because I have had patients tell me that the pain went away fairly promptly, like in about 2 or 3 or 4 weeks. But it took them months before they could get up the courage to go back to doing everything that they did before. So the point is, take your time and do it a small amount at a time, a little bit at a time. But don't give up. As I said before, if you try something and you get the pain back, then say, well, I'm not quite ready. But if you stick with it, you'll make it. And that's what these patients all tell me. When they stick with it, eventually they make it.
Doctor, I understand what you're saying, but on a deeper level, I'm having trouble accepting this. Every time I go for a bike ride, the next day I ache all over. Is it that my muscles aren't ready?
No, it's that you're still programmed. And remember that at this stage of the game, you're very early in the game. And therefore, you can expect that you will react to these physical things the way you have, you know, for months and years gone by. So the point is that to work on this, do your studies, do your homework, and give it time. And then a few weeks down the pike, you try and see what happens. Yes?
Dr. Sarno, I understand that TMS is the source of my pain and I need to get back to full activity, but what about my herniated discs?
Remember what we said before. The herniated disc is like gray hair of the spine. It means nothing if you're in this program, if you've gotten this far. In other words, in the great majority of the cases, these disc abnormalities are not abnormal. They are normal abnormalities. They're things that happen as you go through life. Yes?
Dr. Sarno, we keep on hearing about the time. How much time does it actually take for the process to start working?
Well, I hate to tell you that this is extremely variable. And of course, naturally, we all like to have things be as concrete and solid. If I do this in 2 weeks, I'll be fine. In some people, it goes away after they've been through the program in a matter of 3 or 4 weeks. In other people, it takes 2 or 3 months. And in other people, it takes longer than that, particularly those that have to work with a psychologist. So the best thing to do, I know it's terrible to be so uncertain, the best thing to do is to say that I'm going to do this, I'm going to do my work, and try not to focus on the amount of time that's taken. That may actually slow you down a little bit. Yes?
Dr. Sarno, what if the pain just doesn't go away?
Well, that will indicate that some of the stuff going on inside is just stronger than we think, and usually that brings on the recommendation for psychotherapy. These therapists are trained to help you look inside and indeed to actually feel some of the feelings that you've been unable to feel. What I see this as a kind of bleeding off of some of this anger, some of this rage in small amounts. Well, you'll be glad about this. What you don't have to do to get better, first of all, you couldn't change your personality if you wanted to, but you don't have to, obviously, in order to get better. You certainly don't want to change, or most people don't want to change their lifestyle. You can't feel, remember, rage that's in the unconscious, and you can't express what you don't feel. But to reiterate, this is not what it requires to get better. Knowledge is what it requires, awareness, information. Yes?
Dr. Sarno, as I understand, I don't have to feel my rage or express it. I just have to accept it.
Exactly. Accept the fact that it's there. You sort of have to imagine. Imagination is important in this instance because we don't feel these things. But you get into the habit of realizing that this pain that you have now is because of that rage that's down there. Yes, that's what you have to do. Yes?
Dr. Sarno, everything you're saying is actually starting to make sense. And I understand it, but I'm not sure if I believe it 100%. To what extent do I have to believe your diagnosis in order to get better?
Unfortunately, you have to believe. The term, you know, is a little unfortunate, but there really is no other way of saying it. You have to be able to say, I know that this is what's going on. Because if you don't, your brain is just going to keep on doing what it's been doing. Just continue the old ball game. Now, in that regard, many of the people that who have worked with in the past have said, you know, I see the logic of this, it makes sense, but oh, I just can't get out of my head that I've got that disc back there, or there's something else back there. That's really your brain trying to keep you involved in this. And so what you have to do is to just keep working away at it. This is a very important point. I am trying to, what I'm doing is trying to convey to you a set of ideas. And we do this so that when these ideas are accepted, when they have been sort of digested by you and taken in, that your brain is going to stop producing this. In other words, this is really a sort of exercise in preventive medicine. It's going to prevent next week's pain and next month's pain and next year's pain. Rather than this, I don't want you to learn a set of words to say and say, once the pain is there, now if I say X, Y, and Z, the pain will go away. That's what I characterize as aspirin treatment. We don't want that. What we want you to do is something more fundamental, to get these ideas on board so that you will not have the pain in the future. That's what we mean by this. Yes?
If the idea is to focus on the long term, what do you do when the pain is there?
In the short term, take painkillers if necessary and keep working on your program. That's really all you can do. The point of this bit of poetry is simply to establish the fact that your unconscious mind, the poet's way of saying that is the heart, is slow to learn what your swift conscious mind beholds at every turn. In other words, I hope that as a result of this presentation, you're all going to have a very clear idea of what this is all about and how it works. Now what you have to do is convey that information into your unconscious mind. And your unconscious mind is going to be slow to pick it up. It's even going to be resistant to pick it up, as was brought out by your question. So give it time and work on it. Yes?
Dr. Sarno, I understand now rationally what you're saying is the true cause of my pain. But why is the unconscious so slow to understand these ideas?
First of all, it doesn't want anything to change. And secondly, that is the nature of the way we're built. As a matter of fact, just think about it. If we could change things in our unconscious minds just like that, we'd probably all be psychotic in a week because everything would be changing immediately. You'd be hopping from this to that and so on. So actually, there's a bit, it's actually a good thing that the unconscious is slow to accept these things. It needs time to evolve. It's a wonderful phenomenon, the placebo. It's Latin, you know, and it means I shall please. And what it refers to is the fact that even a useless treatment can produce good results if one has faith in the treatment. Now, you might say to me, Yeah, it's based on blind faith. Why then doesn't everybody use placebos to treat people if they're so powerful? And indeed they are powerful. Placebos have been known to reverse cancers. And the answer, of course, is here, that the result is almost always temporary, and of course that means that it's bad treatment. So we don't want placebos. I don't want this to be a placebo treatment because I want you to have a long-term permanent result. Yes?
In my almost 20 years of back pain, I've tried a lot of treatments, and some of them didn't work, but some of them did, but none of them ever really lasted. So I guess this is what you mean by
I
the
think so.
placebo
That's
effect,
very,
right?
very common. I think that many of the treatments that people have that are addressed to this as a physical disorder often give them some temporary relief. But that's precisely the point. They don't get better, and that's why we are so assiduous in making sure that this is not a placebo program. Now, this is the opposite. And this is a very, very interesting thing. Of course, we referred to this earlier when we talked about the fact that people will get pain when they lift something up heavy or something of that sort. They are often under the impression that this is a bad thing, and so they'll get pain. But many, many other things that are common things, bending, lifting, running on a hard surface, and dozens of others. One should, of course, be wary. And this is why I suggested to you before that it'd be a good idea for you to forget everything that you've ever been told about the reason for your back pain.
Doctor, I sleep on a super hard mattress at home. Whenever I sleep at a hotel, the next morning I wake up with back pain. I've always thought this was because it has a soft mattress. But listening to this, maybe this is a nocebo for me.
You bet it is. It's a nocebo for you. And the other thing to bring in here is that that's how you're programmed. So nocebos work through the programming process, the conditioning process.
Dr. Sarno, when I do experience pain, it seems that the pain starts to be more severe when I'm walking on a hard floor as against when I'm walking on a floor that's carpeted. Is that an example of what you're talking about?
That's an example of what I'm talking about. And again, as with this gentleman, you're programmed to expect it under those circumstances, and so that's when you're going to get it. Exactly. Remember, the brain tries to keep this process going. Oh, there are dozens and dozens of these. Once more, let me repeat, try to forget the things that you've been told. The back is not easily injured. As a matter of fact, it's probably the strongest part of your body because you're up on your feet all day long, and that means that these muscles have to be working all day long. Your tummy muscles don't work, and that's why a lot of people get a rubber tire around the front here, because the tummy muscles aren't working all day long, but your back muscles are. This is not true. 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 And this is not true. In other words, these are some of the many things that people are taught about what goes on in the back and what does not go on.
Dr. Sarno, I've been told that you should never bend without bending at the knees first. Is this correct, or is this also a myth?
I believe it's a myth. And it's amazing how many people do that. I mean, virtually everybody, when I'm examining them in the office, when they come up, will always bend the knees first and come up. It is not true. I haven't been bending my knees for years, and I'm still here and don't have a back problem. Yes, sir.
Dr. Sarno, I often hear people say, my back went out. Is this an example of what you're talking about?
Well, actually, that phrase is easy to understand because very often people will get sudden, sharp pain in the back, and not infrequently, they'll hear a noise. Now, I wondered about that noise for a long, long time. And I suspect that it may be the result of what happens when there's a manipulation in the back, you know, and you get sort of like cracking your knuckles, only this is cracking your knuckles in the back. Your back did not go out. That's impossible anatomically. What happened was that you had the sudden onset of TMS with severe spasm of the muscle.
Dr.
Yes, sir.
Sarno, I can't tell you how many professionals have told me not to do everything that's on this list. Now you're expecting me to just assume that that's all incorrect and I can do all these things.
It's been my experience that you can ignore all of this. Yes, sir.
I hear you telling us that these are all myths, but when I'm in pain and my back hurts, I'm frightened to bend over for fear of making my back worse.
Well, of course you are, but you're now in a new mode. You're now in an educational process, and you're going to try little by little to put all of that behind you. That's what you have to do. It would be hard to overestimate the importance of this factor in this as well as in many, many other medical situations. Fear makes everything worse. And when people have a back pain history, they fear what the MRI shows. They fear hurting themselves because they've been under the impression that that's what's been happening to them over and over again through the year. They fear one of those acute attacks such as we described just a moment ago, as when the back goes out. They fear doing things physically, and of course as time goes on this usually gets worse and worse. And they are afraid of what's going to happen if they continue to have this problem, what's going to happen to my life, my job, my family, and so on. So it's extremely important that all of your fears in the process, in your studying, in your educational process here, that you try to overcome all of these fears. Another very interesting thing, if your pain should go away, but you continue to have any of these fears, it is going to come back. Yes?
Fear is really a big issue for me. Am I going to have to get over my fear of all these things before I can be pain-free?
Oh, no, you can probably be pain-free, and it may take you a while to get rid of these, but it's something that you want to work on. That's why I said before, if your pain goes away but you still remain fearful, the danger exists that your pain will come back. This is something that may take you quite a little while, but you sort of work into it gradually the way you work into your physical program gradually. I thought you'd be interested that in a follow-up survey that was done recently, 6 months after, on these 85 patients, 52 are women, 33 were men. Generally, it's about 50-50. Probably the next 100 patients that I come to, it might be the reverse. So we don't make too much of that. But 70% of these 85 patients were either completely pain-free or almost pain-free, and 75% of them were back to essentially unrestricted physical activity, and this was only 6 months. I suspect that some of these patients who may require psychotherapy will get better in time, so that if we do another survey another 6 months or a year from now, I expect that these figures will be even better. But that's pretty good in my estimation for a group of patients with severe pain problems that have been going on sometimes for months and years. Yes?
What were these patients suffering from?
They were just like you. Disc problems, arthritis of the spine, spondylolisthesis, scoliosis, the whole kit and caboodle. All right, it's very important now that you be able to answer yes to all of these things. That is, I have little or no pain, I'm not afraid anymore, and remember that may take some time. I'm not afraid to do physical things, and that may take some time. And I certainly don't intend to have any more physical treatments of any kind, because this is not a physical disorder. One word, what do we mean by a little pain? We are not going to change. We said that before. Our personalities are going to stay the same, and that means that there will always be a tendency to have perhaps a little pain here and there. But your measure of success should be, am I limited in any way in my life? Does this stop me from doing anything? Does it interfere with my life in any way? As long as you can say, no, it's not, a little bit of TMS pain is okay. Thank you for your attention. Sure. Thank you. All right. Okay.
After attending my lectures, patients often ask me, now what do I do? The principle behind getting better is to understand what TMS is all about and to acknowledge that TMS and nothing else is the cause of your pain or your numbness or tingling or weakness, regardless of where you're feeling these things. It's important to remember your pain is due to TMS, not a structural abnormality. The direct reason for your pain is mild oxygen deprivation. TMS is a harmless condition caused by repressed emotions. The principal emotion is repressed anger. TMS exists only to distract your attention from the repressed emotions. Since your back is basically normal, there's nothing to fear. Physical activity is not dangerous, and to get better, you must resume all normal physical activity. You must not be concerned or intimidated by the pain. Becoming pain-free is all about shifting your attention from the physical pain to the emotional issues. Think psychological, not physical. This process takes time. Be patient and work at it daily, following the study guide enclosed with this video. As you now understand, feelings generated in the unconscious mind can create real physical changes in our bodies. Most of these feelings have to do with who we are and the pressures of everyday living. So it's normal to have these feelings, and it's also normal to have physical reactions to them. You now also understand that these physical reactions can be stopped if we put our minds to it. This is a very good example of the power of the mind and what mind-body medicine is all about. In the words of Norman Cousins, we are stronger than we think, our bodies are tougher than we realize, and can deal with most illnesses and conditions that we get. And our minds can influence what goes on in our bodies and literally make us better in many situations. I hope this presentation will encourage and inspire you to capitalize on the power of your mind and body so that you can enjoy more comfortable, productive lives.
I started to feel better immediately after the lecture, but I also realized that that wouldn't be enough. So I read Dr. Sarno's book, and I focused on the treatment strategies.
And I guess it took a few months, but I started to see some results, and I started to think, you know, this is great.
After I heard the lecture, I could start to identify what the source of the problem was when my back would start to cause me a problem. I usually could pinpoint it to very specific areas of stress in my life. On the flip side, I could ski.
Dr. Sarno was not saying that the pain is all in your mind at all. Dr. Sarno was saying that the pain originates in your mind, that that is the cause of the pain, that the pain is a symptom, and that the pain is real. In fact, the pain is so real that it's making you concentrate on the pain and not on emotions that are uncomfortable to deal with. This was a totally revolutionary concept for me. I started to understand why not everyone was getting better after surgery. I started to understand that why not everyone was getting better from all these physical techniques, because the root of the pain is not a physical one, but a psychological one.
I had to turn things around and start thinking psychological instead of physical, because to that point, I had been programmed basically to think that it was all physically related.
The most important thing to remember is that the brain is using pain to distract the conscious mind from the unconscious rage.
I've learned that if you concentrate on the physical, you're never going to get better. You've got to concentrate on psychological issues, and then the pain starts to go away.
Before I came in contact with Dr. Sarno, I was afraid to run, I was afraid to lift things, I was afraid to do practically everything. And then having seen him and gone to his lecture, I am now able to do the things that I had not done before. I feel free, basically. Someone freed me from this pain that I was in, and now I'm able to lead the life that I had before, the life that I wanted back.
I still have flare-ups every now and then, and I think about it, and it just lifts. Maybe a day, 2 the most. But, I mean, I had weeks, years of terrible pain where I was frightened to move, bend, twist. I was frightened to have a life.
I'm not afraid to do anything now. Once I started to see that I got results from this, you get a little braver and you do a little more and you give up the fear and you find that you can do anything and that you don't have the fear that you used to have.
I think I've come to learn that wanting the pain to go away really quickly sometimes causes it to hang on longer. And what you really have to remember is that you have to be patient. You have to put his work into practice on a very steady, very patient, very logical level, and just keep at it. Absolutely keep at it. Don't doubt. Just go through it. Keep at it.
You heal every day. You deal with it every day. You have to face it every day in how you cope with life.
You can't just talk yourself into it and say, I believe, when deep down there's a fragment that it really doesn't believe, that you think you're going to get better just by saying, I believe. You truly have to accept the premise, because the premise is a fact. And once you accept it, you're going to be better.
I'm feeling great. On a scale of 1 to 10, I'm a 9. And when I was hobbling around, I was a 4 or a 3.
Being pain-free is great. I mean, if you've lived with pain a long time, going back to doing everything you did before, doing new stuff is, I mean, you can't put a price on that. Dr. Sarno and his philosophy has really given me my life back.
Dr. Sarno truly is my little miracle worker. Without him, I don't know what would have happened to me, and I'm able to have my life back, and I can't say enough about him. He's just a remarkable man.
I think Dr. Sarno is a diamond, but he's a diamond that doesn't cut. And I think he's great, and I think we should all be thankful for people like him and what he has done and how he has saved many people from surgery and from pain.
I am feeling well. I feel relieved. I feel unburdened. I feel very privileged to have met Dr. Sarno and worked with him. It's something that is a blessing, and I wish more people would know about it.